It's kind of interesting because when you look at all cancers in the United States, it's rare. Most cancers today, our treatments are great. Patients will do well and survive. We have more cancer survivors in the United States than we do have newly diagnosed. Okay? And what we're dealing with now is this, and this is kind of why we have this Survivorship Series, is we have this huge population of cancer survivors. You guys are cancer survivors that have been treated, but also have developed lifelong changes, in function, and lifelong emotional and psychological changes that will affect you. And that's the purpose of these support groups, is to empower the survivor to be more comfortable and understanding, because the reality is most people will not die of their disease, but they will suffer lifelong side effects that are livable and not, will be fine, but they're there, and you can't deny them. The way you pee, the way you move your bowels has changed, but you've been successfully treated for a very aggressive cancer. It's one of the pitfalls. So that's one of the goals, is to develop not only who we should treat, but to develop better therapies so that we don't have these side effects. And survivorship, this concept is a huge idea, or there's a mass impetus or momentum to start looking at you guys and helping you, focusing on the survivors, because there's so many of them. We have this Survivorship Series at Beaumont. We just developed a survivorship clinic where patients can go see therapists, psychological, emotional, and physical, problems associated with prostate cancer or any cancer treatments, and get help. We're talking a lot about the physical, but there's a lot of psychological, emotional. There's a lot of financial too. Yep. You deal with people who, cancer, there's a lot of recent literature is patients who don't have the financial means, either they can't get off work or they can't afford treatment, their cancer outcomes are different. They don't do as well. So another big part of this group, of our foundation, is we set up a fund. We call it the Blue Fund, and the foundation's been together for 5 or 6 years, and we've collected money, and we have this fund. If a guy is in financial distress, we will support him or his family while he's getting treated. So if he can't make his car payment, if he can't pay his rent because his co-pays, his doctor bills are too much, or he's taking so much time off of work, we will give these patients money so that they can continue to get their cancer treated, as well as take care of some of their bills. Because we know patients that unfortunately, the reality is, if there's financial distress, their cancer outcomes are compromised. So that's why our foundation is set up this fund to help guys in Southeast Michigan who are having trouble, who are being treated for prostate cancer. And it's a great thing, and we've started to help a lot of people who need help, just so that they can get through and get treated.